But I do remember when I was in a downward facing dog, which is a very popular position in Hatha yoga, after my dad died, there was a lot I didn't get from my father, but when I was in that position, I just remember breathing and feeling like he had given me something that I could fall back on, like a lineage that I could fall back
That's
on.
nice.
And that was really profound for me in that moment because I was always so focused on what he wasn't giving me.
Welcome to Paradox, hosted by Dr. Sherry Ross, leading OBGYN, and Dr. Tammy Nelson, world-renowned sex therapist. Two experts, zero filters, full truth.
So today's guest is Mandy Ingber, a renowned yoga instructor, a wellness expert, astrologer, and best-selling author. She's here to talk about yoga, making it cool and sexy. Mandy Ingber, it's so great to have you here today. Thanks for being here.
Thank you. It's great to be with you too.
Mandy, you are one of the trailblazers of yoga.
It's funny to hear you say that I'm a trailblazer because obviously yoga has been around forever. And my father was my original yogi,
that.
right? So to me, I think I was just right on time to seem not weird. The way that when I was a kid, it was a little bit like weird and out there. And I definitely, I felt that when I was a kid. And I sort of wanted to bridge that gap for people that felt like intimidated by it. I think when I started teaching, it was intimidating for people. And my whole goal was to just make it very accessible.
Yeah, you really have. And I have to give you a shout out because it's probably because of you that we are sitting here today, Tammy and I, because we were at a birthday party of our mutual friend, Mary Conley, her birthday. Do you remember in the kitchen?
Yes, I do.
And we were talking and you said, you really need to do a podcast, talk about women's health and find a partner who you could do it with.
Yeah.
And so fast forward, and that was really one of the other reasons I wanted to have you here today, just to thank you.
Oh.
And you inspired me.
Thank you. Well, so I love being at that's like the inception or the inception or the seed of the baby of your podcast. And I pride myself on being, there when people are starting things. I like to be that witness, which is, actually just to, go off for a second. I think that that's what the cultivation in yoga is the cultivation of the witness. And so I like to actually be a witness and it's, whatever. I like to teach. I like to teach people to witness themselves, and I like to be a witness.
That's nice, though. I like that.
I think the reason people feel intimidated by it is because they look at the positions that people who have been practicing for a long time, but not only that, people whose bodies just sort of organically go into those positions. Like I think that I was attracted to yoga because my father did it, but also our bodies kind of naturally went into those positions. We're hypermobile, we're super flexible just by nature. And that's not the yoga, the postures are not really the yoga. So I think that people get intimidated when they see that. But just really in a simple way, it's really a connection through the breath from the mind to the body. It's probably very similar to sex or having a baby. It's a connection
and that your dad introduced you it when you were 7.
Yes, my father was very forward. He was always really body aware, almost to his detriment. He was super obsessed with his body, and so when he was a great example though, because I just kind of wanted to try that too. And to be honest, it was a little bit of trying to connect with my dad. Like,
has he seen you evolve into this sort of trailblazer in the space?
Well, my father passed, funnily enough, he passed away, to 21 or 22 years ago. But I started as a spinning instructor. That was my introduction to being an instructor, a teacher. And I actually learned as much about yoga from being still in on a spinning bike as I did from practicing when I was a kid. It's almost like I got it more once I just took out the complicated, like the gymnastics of it and just sat in a spot and started to just get connected to my breath. So, so I really simplified that. And so my dad did see me become a teacher, but I didn't start teaching until right after he passed. And opportunities just came my way. So it almost seemed like angelic forces were guiding me. But I do remember when I was in a downward facing dog, which is a very popular position in Hatha yoga. After my dad died, there was a lot I didn't get from my father, but when I was in that position, I just remember breathing and feeling like he had given me something that I could fall back on, like a lineage that I could fall back on.
That's nice.
And that was really profound for me in that moment because I was always so focused on what he wasn't giving me. And then, when your parent passes, there's one part of it, which is you mourn all the things that you didn't get, but you also mourn what you had that you didn't realize you had, So, so that's like, whatever.
I like that.
Yeah.
I like that.
Tribute.
Yoga has been very helpful to me actually over the past couple decades. It kind of saved me in some ways. But as I've gotten older, it's just harder to do it. And you have to do it. I have to do it more often to stay flexible and to be able to breathe and to stay in the positions and stuff. My knees hurt, my back hurts. I have Lyme disease. Everything creaks. But I also love spinning.
Oh, yeah. Spinning I actually like teaching spinning even more than I like teaching yoga.
Really?
Yeah.
Interesting.
Because everyone can do it. It's a very simple exercise. You're in your own space. It's not like you feel like you're not comparing yourself to other people. You can go at your own pace. There's only, 5 movements, 3 hand positions. It's so simple. And you get the feeling that you're an athlete and you can do a lot in that space, which is why I love it.
You can push your own edge.
Yes, exactly. Without having to do really complicated things, you know? So, yeah.
I like that. I like you can push your own edge in yoga too, but if you're in a yoga class, there's
okay.
There's a what?
There's a little bit of a competitiveness too, like looking around like.
Yes.
And, I use yoga as a metaphor a lot of times with my clients. Like just because the person next to you is putting their foot behind their head doesn't mean you have to put your foot behind your head. Like you have to find your own edge.
Totally. There's a teacher that I stole this part from, which is, he used to say, one of my teachers, Brian Kest, who used to say, the only difference between a flexible person and a person who isn't flexible is that the flexible person has to work harder to get the same feeling that an inflexible person gets without going as deeply. So we're really just looking for that edge, like you said. And then I always say, well, whatever, the guy next to you can put his, head on his knees, you're probably a better kisser. So it's it's like we all have our strengths,
I mean, how did you create the yoga philosophy idea? Because it's so forward thinking and I love the connection.
Thank you. I wanted to bring together, so for me, my whole journey in teaching fitness started with growing up, becoming anorexic as a result of, being like an over-exerciser and a perfectionist. And so I had to, I let myself gain weight and be all the things I was afraid of. And then that's when I started teaching. And so for me, a lot of when I was teaching, I was framing sensation and also the way that we think about our bodies, like really exercise, yoga, spinning, anything. It's a celebration of your body. It's just about being in your body and, having gratitude for it. So I wanted to have it, I wanted people to love their bodies into shape, basically.
I just have to, because there was a quote that I just love that you said, and I'll just quote you. It says, "I believe that having the body you want begins with loving the body you have."
Yes.
Just love that
Yeah.
you said that.
Well, and I mean it because
Yeah.
I spent a lot of years not loving my body and being even super skinny and not thinking I was, it was just, there was so much psychology around, what the body looked like. And I think really I have so much sensation in my body, like that I was uncomfortable and I was trying to get out of my body. But then when I really settled in and I started to just like get into how I felt, it was like, it's such a miracle. It feels so amazing to be in the body, so I just really started to do that and enjoy exercise for the feeling that it gave me rather than what I could achieve, how I looked. And it just, my body fell into place naturally doing that, and sharing it with others. So that was really, so it was those classes actually at the end. Those were the classes that started my philosophy basically about loving your body into shape. The book Yogalosophy, there's different. So there's the workout that I created, which pairs a yoga pose with a toning exercise, so I wanted to make it familiar, easy, like a simple yoga pose with a familiar toning exercise. And I wanted to make it short, so it's like 35 minutes. And when you're
that
done,
short?
It's pretty doable.
it's doable. But then when you're done, you feel like you worked out, right? So I wanted to sort of, I'm a yoga purist, but I also wanted to give something different, offer something different. So that's how the workout came through. And then the actual like 28-day mind body makeover, that program goes through a full lunar cycle. So I also do astrology. And so every 2.5 days, basically the moon changes astrological signs. And so I didn't say this when I wrote the book, and it originally came out in 2013. And it's a New York Times bestseller, just saying.
Congratulations.
Thank you. I mean,
Yeah.
But anyway, so I take everyone through a full lunar cycle, but through physical exercises, through breathing exercises, through journaling, all through the lens of like a different astrological sign. Actually,
It's very cool.
It's really fun. It's a really fun like workbook.
So what did you think about the recent full moon that Pisces full moon, that you have to let go and then you have to step in, and it's, what you're stepping into is for the rest of your life. I'm sorry. I just have to detour. Yeah. I need an expert opinion.
So the last, what happened for you? I mean, like, so basically So the last new moon, just for your audience member, or the last full moon was in Virgo. The sun was in Virgo and the moon was in Pisces. Okay, and it was in eclipse. So an eclipse is a marker of 6 months, basically. So it's kind of like a 6-month chapter that we're entering. The sign Pisces does represent letting go, dissolving, releasing. So that's an interpretation. And depending on where your personal planets are, it will affect you in one way or the other.
Oh, okay.
So what do I think about it? I mean, what's your sign? What's your chart look
it
like?
affect you?
I'm a Leo.
Oh, you're a Leo.
Virgo rising.
With a Virgo rising. Okay. So it's for you, just
this is important.
Without knowing.
I
Yes,
wanna know.
I'm sure all of your listeners want to know about your astrology. For you, it's about relationship. It's self versus the other. Okay, so there's and I mean, how perfect, because you're a couples therapist, right? So it's about relationships and the dynamic pull of, you said Virgo rising. So there's something you're letting go of about your identity, and there's something you're like leaning into in terms of relationship, and even like surrendering into relationship or something like that.
We were just having this
This is
conversation
good.
like 5 minutes ago.
Yeah.
Okay. Well, so that's the astrology. I mean, so
I love that. I'm next.
Yeah,
No.
exactly. Well,
That's great.
that, and funnily enough, in my spinning classes, I used to use, it was a long time ago. I started teaching spinning in 1996. So of course you're not going to exactly say, oh, the moon is in da 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 da, but I would but I would use the astrology in my teaching, and people would say at the end, I mean, it was a lot of things. I'd use my own personal experience too. And people would think you're talking to me, and I was just like, it's just the astrology, really.
But I mean, people that study it and use it, I mean, there's definitely a conversation to be had. My cousin Darren is into it too.
Yeah.
And I'm always like, oh, okay. Yeah.
Right. I know. It's kind of like, how does this actually, and to be honest, I'm not the kind of person, I just, I sort of just go with it. Like I don't need to have, like the scientific, I don't need to know how the light switch goes on, why the lights go on when I turn on the light switch.
Mhm.
I just know that the lights need to be turned on. You know,
Right,
that's
right.
it. You know,
So it
Anyway.
works for you. You don't
It
need to know
works.
the science behind it.
great.
and-
I don't really. I mean, and I think that it's debatable if it's science. You know what I mean? I think it.
But what you just said to me was right on the money.
Well,
so
there you go.
It's really good
It's
therapy. Like 5 minutes of good therapy.
That was really good.
Yeah.
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 So what sign are you?
I'm Aquarius.
You're an Aquarius.
Do you know what your rising sign is?
Oh, when's your
I'm just happy
actual
to rise.
but when's your actual birthday?
January 21st.
Oh, so you're January 21st?
Yeah.
Oh, so you're
I'm on the
right
cusp.
before Pisces.
Yeah.
Oh. Okay.
I don't like that.
No,
that's
because what I
okay.
was trying to think
Yeah.
about is what's going. Oh, but that's pretty close to where it's pretty close to where the eclipse was. But I would want to look at stuff before I gave you any information.
Okay, I appreciate that. We can.
Two of my
Another
best
time.
friends have like the same birthday as her.
Oh, really?
Really?
That's why we get along. so
Yeah.
well.
I like
Yeah.
the sign.
Yeah.
Yeah.
She works for me.
Yeah.
But I will say, just the yoga piece of what the studies are looking at, so many studies looking, of course, we know it does balance and strength and
Mhm.
calmness, but how interesting of lowering your heart rate and good for heart disease and other symptoms of stress and depression. And,
Mhm.
we're using it now for menopause and
Mhm.
balance
Mhm.
and strength.
In what way? Like, in what way are you using it? I'm
Well,
curious.
So for hot flashes and
Mhm.
vasomotor symptoms,
Mm-hmm.
where you get hot flashes by day, night sweats at night, your heart races, like palpitations, and it almost feels like you're getting an anxiety attack.
Mm-hmm.
So
By the way, I'm a 57-year-old woman. It's like,
You're pretty familiar with these
am I
things?
speaking to you?
No, I mean, you know what? Maybe it's because of all the yoga that I've had a sort
Easy?
of, not in the beginning. I was very crazy.
Yeah.
Like and very depressed.
Yeah.
There wasn't enough yoga on the planet to
help you.
help me with that.
Yeah.
But I do think in terms of the heart racing
Yeah.
and the anxiety, I think that, yes, I'm sure that my foundation, because I really don't know life without yoga, is the truth.
Yeah. And sleep.
Sleep.
It helps with sleep.
So those were some of we're like
we're all
My
rolling our eyes
favorite.
like, oh.
My
No,
favorite.
not such an important one, but now we're looking at how yoga benefits sleep and
Mhm.
cognition and overall sense of well-being, which are symptoms that get out of hand in menopause. So
Right.
we look at lifestyle and a lot of menopausal treatments, diet, obviously, and,
Mhm.
and exercise, but sleep, stress, and then looking at sort of these yoga, tai chi,
Mhm.
cognitive therapy for sleep. So there's just a lot that people can do as an alternative, acupuncture as well.
Yes.
So I talk about yoga a lot
Yeah.
in these benefits.
Well, what I always say is, talking about yoga isn't practicing yoga. So it's
She
like,
just dissed you, I think.
no, it's not. I'm not dissing you.
I don't claim to do
I'm not
it.
dissing you. Right, exactly. So, yes, I mean, I think it's like, I think it's
That's okay.
No. Did you get dissed before too? Someone else dissed
No, I
you?
feel like you just twice dissed her. Like,
Oh, I
talking
did?
about
I
yoga,
was like,
not doing yoga.
No. This isn't about you. I mean, I think it's a really common for people to talk about the things they know they should do.
Yeah,
Right.
sure.
Right.
And then wanting somebody to convince them why they should do it. Like if I
That's
only,
what doctors do.
That's her
You
job.
basically
That's literally her
summarized it,
job.
Mandy.
but what I will say is like that. So that's what gives someone like me a job, because many people are not motivated to just do the practice, right?
Right.
But also I will. I mean, this is also now a pitch. Which is why I'm just so organically this person. But so my book, that's what it's about. It's about how do you motivate yourself on a daily basis just to do the daily practice.
Yeah.
And so I try to offer a different lens each day, because one might work for you, one might not. And that's why finding the right teacher and the right class, I always suggest to people that they try, like 6 different types of yoga or 6 different teachers, because you might hate one person and think that it's the yoga, but it's just the way that they're delivering the teaching.
Totally. There's some really popular yoga online that I'm like, this does not work for me.
Which ones?
I don't know. She's really young and she's
just kidding.
Fast. It just doesn't work for me. Like, I don't like it.
Right.
And first of all, 10 minutes a day is not really going to work for me either.
Oh.
But I say that, as someone who does yoga like maybe once or twice a week. So
Right.
maybe 10 minutes would be better, because if I miss once or twice a week, then I'm not doing it enough.
Again, I think in this case, any exercise, I'm sure that any exercise, you find one you like, even if it's walking or spinning or whatever. So it doesn't have to be yoga. That's another reason why I called it yogalosophy, because you can bring the yoga into any activity that you really love.
Yeah.
And it's just a matter of being conscious and knowing that that's what you're doing, so you're right. And
it helps with your sex life too.
Exactly.
Helps with the breathing, your pelvic floor, all of that.
Yes.
I mean, what's the difference between...
That's very motivating for a lot of people.
Yeah.
Yeah.
Right. Well, why should I do this? Because you'll have great sex.
It's good for your heart.
Well, yeah,
you also have a better orgasm.
Right.
That's always good. I mean, so then what is the difference between restorative yoga versus sort of this conventional yoga?
You mean in terms of results or in terms of...
Well, right, because that's
is?
what they recommend for, over 50 women.
For restorative?
Yeah.
Oh, beautiful. Restorative yoga, and it's so funny because it's so perfect for our time. So if you go into restorative yoga class, it's basically like setting yourself up for basically a 5-minute nap position. And so
like
that
cushions.
okay.
And so
now it's all making sense.
Which, by the way, your basic, it does make sense, because we don't rest enough. We don't. And so it's not like going to sleep, but what happens is it relaxes your nervous system.
That's what it said. That's what I was reading. It's like, okay.
Yeah. So some people can't, don't want to take a nap, or they don't know how to just kick back and relax. Unless it's, with a glass of wine, and, then we're
Is there
sort
a
of
position with that?
I think there actually is like chocolate and wine yoga or whatever.
Really?
I mean, there's all sorts, there is,
Okay,
of
I've
course.
heard of goat yoga.
There's goat yoga
and
too.
puppy yoga. I've never heard of chocolate and wine yoga.
Yeah, there are people that do that, of course. So it's like whatever gets you there. But basically,
Going to that yoga class.
Mandy's for hire.
it's like I don't do that one. I think you guys can do that one on your own. That's called babysitting. But anyway,
That's very
so
funny.
you just so the restorative yoga is that, and I love restorative yoga because look, when I had this boyfriend that was also a spinning instructor, we used to joke about, we need to teach a snuggle class. It would be because it was like it's so healing.
They do have that, cuddle
Now
therapy.
they do.
See,
that
you were ahead of your time.
I always am.
You should have thought about that.
I know.
You really
I
are.
did think about it,
But you didn't do it.
we broke up.
Sorry.
No. Oh my God, I'm so glad that happened. But what's interesting? I've been watching couples therapy.
Uh-huh. Mm-hmm.
You don't like it?
I don't need to watch it. It's like being at work.
I get it. That's how I feel about yoga. But anyway, you're in couples therapy. I realized watching that show that I never got the right help that I needed.
No.
I never got the right help. It wasn't because I was not looking for help. It was because I never, there's like a lot of not good therapy out there.
Oh, that's true.
But the opportunity wasn't there for me when I had that one boyfriend who was the kind that showed up.
Mm-hmm.
Any other boyfriend I've had since then has been an inconsistent partner.
This is a message for all of you good-looking guys out there looking for a really cool partner.
For really, really hot,
Flexible.
57-year-old.
Very flexible partner.
She could do any position.
Yes, I can do any position, but okay.
That's
No, but that
funny.
makes sense. I mean, it takes just like you're looking for different yoga instructors and you tell
Yes.
people try 6,
Yeah.
people should look for different couples therapists too.
Yeah, well, and then I did that with another. I did 4 different therapists with one of my boyfriends, but we always ended up turning on the therapist.
Oh, you sound fun.
Exactly.
You were
It
that
was-
fun couple that comes to therapy.
Do you have other people like that?
Well, I don't let people turn on me.
Okay.
No.
I could never turn on
No,
you. I can tell.
Tammy's not
I would
turnable.
kick you out, Mandy.
Well,
I would've
you wouldn't be
fired
the
you.
first.
Wow, you that
Yeah.
tough in therapy? I'm so
Yeah.
surprised.
Oh, yeah. No, I went to a woman who was a social justice therapist that
Yeah.
would work in prisons.
Yeah.
And she told me that I was the most disrespectful client that she ever had, which is why I need yoga.
Wow.
Right. And which is why actually I'm like even a decent teacher because and you'll find this with a lot of yoga teachers.
I'm a little afraid of her now.
Really?
Don't say the
I
wrong
made
thing.
you afraid of me?
No.
Well, I'm not going to you. I'm not like
No, but you're not disrespectful here, so
No.
I'm not seeing that side of you.
Is this maybe this is disrespectful?
No, I don't think so.
Oh, am I co-opting your?
No, not
you
at
can
all. I
cut
want to
this
hear the
out.
story.
No,
You can
I
cut
wanna
this
hear the
out.
story
I want to
too.
hear.
Okay. No, I mean, what I was going to say is that's a lot of yoga instructors were either like addicts or have their own,
Really?
deeper emotional issues. My, there's anger issues that people have. I mean, there's so many. The reason we come to yoga is because we had those problems or have those issues. Whether it's the inflexibility, whether it's like trying to heal from like my father started yoga because he was having back issues and he had slipped discs. And that's how he started.
Wow.
But for me, the yoga has, on a much bigger scale, it's like given me, I have detachment, so even when I'm being jerky, I have awareness and detachment. But that was what made me realize that it's always the discomfort in my body that I'm trying to work with.
Interesting.
And for some people, it's like pushing an exertion or the pain of, like hitting that edge. And for me, it's like holding multiple sensations at once, which is what I think emotions do.
Oh,
Like you're feeling so much at once.
interesting.
Anyway,
Interesting.
Yeah, that is.
So-
please cut this out.
No, I'm curious.
It's
Like, how does that show up as disrespect in therapy? Like,
Well, because when you feel that feeling, all you want is to have it out of you.
so you
And-
project it onto other people.
Yes.
Oh,
Like
interesting.
that can be a thing. I mean, has that nobody's ever done that
Well,
to
no
you
one's
before?
ever described it the way you're describing it.
Yeah. But hasn't anybody ever like done like basically made you the bad guy or
Oh
something?
yeah, people are jerks, of course.
Yeah.
But
Yeah, yeah.
But I've never heard someone describe it in that somatic way that you're describing it.
Yes. Right. Exactly.
Mhm.
Exactly.
Yeah.
Well, I'm a very somatic person. I mean,
Yeah.
I am an embodied. That's the whole deal for me.
Mhm. Well, most people who come to therapy are really in their head. They're not really in their body. That's why there's a big movement to do somatic experiencing and somatic therapy so they can be more in touch with their body.
Mm-hmm.
You know, so
That's
kind of
why-
ahead of the game, actually.
Well, I think I'm in my head too, which is why, and I think I get in my head to get out of my body, to not feel all the sensation.
Interesting.
It's all, for me, it's all geared around how can I stay present,
Interesting.
and with discomfort. That's what it's all about, right? Like emotional discomfort with couples, having, I know that you don't
Well, I do-
deliver babies anymore, but
I do a little bit, but yeah.
well, but it's so the discomfort, that somebody's going through. I mean, it's so that, and on a lesser degree, for me, taking people through the discomfort of the physical edge, having a guide, having somebody there who can be the witness, hold space, is a great. It's like you get to practice, and then when you're by yourself without the person, helping you in whatever way, then you can always remember, like, okay, like I can do this, right? So anyway,
You must talk. I mean, you almost are a therapist. You're certainly a
Yeah.
physical therapist, not the just physical therapist as it relates to yoga. But I'm sure you provide a lot of really positive conversation.
yeah, that's like really what the job is actually. Like when you're with private clients, I mean,
Yeah.
it really ends up being that. But just because of the nature of being so personally connected with people. And I mean, that was the same thing with teaching groups. You know, you know, you realize you're responsible for these people. Like, people are so vulnerable in their body, you know, and
it must be easier to teach privately then.
no, I like groups better.
Oh, you do?
Because everybody cancels each other out. You know, it's I can be very codependent, and there's something about like a group, and also some people don't. You know, people respond when you're in a group. I'm sure you felt this. Like, think about having a private trainer, and when you have a private trainer, all the focus is on you, and it's like at some moments you might want to check out a little bit. If you're in a class, you can just take what you like and leave the rest. You know, you can just pick up on the things that work for you.
Yeah.
That's true.
So I like that better because
That's why I like classes.
Yeah,
You can hide a little bit.
Yeah,
Me
but just
too.
in
You
general,
can sit
there's
in the
less
back.
pressure.
exactly.
And because
Exactly.
yoga brings up a lot of emotion.
It
Like,
does.
you know, whenever you do the heart opening ones, like the camel one, I always cry. And
Right.
I used to cry in like the.
You don't cry in
why?
spinning?
No, never.
Cry from pain.
No, I
Like,
never cried
ouch.
spinning. Maybe I'm
So-
not going to the right spinning class.
But wait, why the position?
Oh.
There's something like the heart opening positions that feel very vulnerable. Like, I've spent my whole life like
Yeah.
slouching and hiding my heart space. Like, I still, as an adult, I still slouch.
Yeah.
And so there's something about
Yes.
just opening that space energetically that just hurts, and it just brings up so much, and I
Yes.
always cry.
So I want to share with the audience that doesn't practice that heart openers basically are anytime. It's literally like when you're opening your heart, like arching your back. Like, for instance, a bridge pose, or a camel pose, or a wheel. Like, what I'm saying is back bends.
Yeah.
So things that are back bendy, but it doesn't even have to be like an actual back bend. It can be something like a cobra position, you know, for people that are just starting, or
Which feels great. You're on the floor and you're pushing up, and it feels like that part feels good, stretchy.
yes. And that one is, I think that one is a really nice one, or Sphinx, where your forearms are on the floor, and you're, you know, basic ones that everyone can, you know, that, or not everyone, but you can start off trying to do. But I agree. I mean, there was a type of yoga called Anusara yoga, and I think something weird happened with the guy that started it.
Of course.
But yeah, of course, all of them, by the way, every one.
Yeah.
But that was specifically about heart opening, and it was specifically geared toward the heart openers.
Interesting.
That one sort of started once I had already started teaching spinning, and so I missed the boat on
I
that.
would have hated that one.
Right, me too.
I probably would have needed it, but I probably would have hated it. So why is every yoga guru, you know, a creep? Like, why does that happen? Is it the power? Is it
Really?
the
Yeah,
acolytes?
I
Is it
think that it's this is a theory, of course. Not everyone, by the way. We just need to say not everyone.
a
A lot.
of
I
them?
agree with you.
Really?
Because it's like, you know, it's just like it's so funny. It's like the easiest trap to fall into, right? Because everybody, when you're like an instructor, people want to project onto you, right? And everybody loves you, you know, your class loves you, and you're like, you know, you're in the power position. It's so easy to buy that press, you know, and it's not, you know, it's just people projecting onto you. And I always know that for me, like, if somebody like really loves me a lot, they're going to be the one that hates me.
Yeah.
You know what I mean? So it's like
Once you're up on that pedestal.
Right. So I generally, you know, I know that. I know that anything that anybody ever gets from me that changes their life has nothing to do with me.
Oh, that's interesting.
You know what I mean? But it's really hard because, especially for men, because men are just so easily flattered.
Their ego is influenced more
That
easily.
is so
somehow.
funny.
They're so easily flattered that I think they just buy into that role. And it's amazing to me because it's like the lowest hanging fruit. It's exactly, you know, I don't know why that happens, except for it's easy to buy your own press, you know? And I mean, look, I'm trying to think of where my ego is. I have a lot of ego too. We all do. But
you
it's
don't
not,
sleep with all your students, I'm assuming. So it's
I always,
different.
I try.
I mean, I'm just making that assumption. I don't know. Maybe I shouldn't.
No, God, no, you should. I actually, yes,
You
no,
should.
no, you
Let's be clear.
No. I do want to be clear because I have a very specific view of my students, or when I teach, I think of everyone as my child. Like
Aw.
they are my child. And so, and also that's why you don't like favor one person over the other. Everybody's my child. Everybody's themselves as a child. And so when I look at people that I teach, that's what I'm looking at.
That's sweet.
So there's no way that I would ever, except for there was one guy that didn't get the wall that I had put up because so that was the one I went to 4 therapists with.
Oh, okay.
So there was a karmic.
Yeah. It's astrology.
He only came
thing.
to my class twice. Yeah.
It was a full moon.
It was exactly. It was the astrology. Totally. 100%.
No, I mean, you're really a healer.
Totally.
Am I healing you right? Do you feel healed?
No. I just listened to you talk. I mean, and I've known you for a while, Mandy. Thinking back, I haven't really known this side of you. We haven't really had this conversation, but you are a healer, a physical and mental healer in a lot of ways for what you do.
Yeah. Well,
That's powerful.
I'm very lucky that that's been a part of me that I've been able to express, and that people have trusted me enough to listen to what I have to say. But and again, I think that's what I want to say again, like yoga, you trust the practice or whatever the physical activity is, you get yourself into a routine and you do it and you just show up regularly and eventually not in too long. Like if you commit to something for even a month, you start to notice things are changing. And that is the trick. So the trick is to captivate people enough. As a teacher, you have to captivate people enough for them to just stay there for long enough so that their own body and their own wisdom comes through. It's pretty simple.
Yeah, I can see how you would captivate people, though, to want to do that.
I know I'm captivating the two of you right now, but I'm not sure that the audience is captivated.
Very captivating.
I think you do have sort of a yoga therapy, mind body, integrative way of talking about it. I think that's important.
Yeah.
Yeah. And people can see your enthusiasm. And plus, you've been doing this your whole life. I think, you embrace the meaning of what this means. It's not like you learned it in 10th grade and you're giving it away.
Right. It's not like I did a teacher training and it was like, I think I'll do this. It wasn't like that. It was totally, it was just organic.
This is who you are.
Yeah,
I just have a question.
For better or for worse.
I mean, I see so many people like, oh, now I'm a certified yoga teacher. I hear that a lot from patients and people. And is that how the process works?
Especially here in LA.
Yeah.
Well, I mean, at this point, it's certainly not like being a doctor, you guys have to put in some time. You have to maybe write a couple of papers, things have to happen in order to.
You got to cut people open. I don't think.
Yeah, exactly. I always think about that when I meet a doctor, actually. I mean, I don't always think about that, but I do think about that. I could never do that. But the thing with being a certified yoga instructor is that, anybody can really do that in sometimes they have some that are 2 weeks, they have some that are 6 weeks, whatever at this point, so there's not a lot of, vetting, but whatever, it's 200 hours, it's 500 hours. And you don't even need to, there was no certification. Like when I was growing up, there were no teacher certification courses, right?
Oh.
There were no teacher trainings. So you don't need to have a certification to be a good teacher, but a certification doesn't make you a good teacher, right?
That's a good point.
So I don't know what to say about that. I think that that's why I tell people to go to like 6-7 different classes before they really decide, because they could be going to somebody that's just not good, that doesn't really have the capability. Just because you can practice yoga doesn't mean that that you're going to be able to help others to get into their bodies either,
That's like
true.
a doctor or a therapist too. I mean,
true.
you got to meet the right doctor or
who says it the way you need to hear it and
right, exactly. That's actually, to me, that's the in terms of being a teacher, that's my strength. It's my job to convey, and each person is different. So that's the communication is really the key.
Yeah, that makes total sense.
Yeah.
So we're going to ask you a question.
Okay.
that we ask all of our guests. Because you have a famous OBGYN here
Yeah.
and a sex and couples therapist, is there anything you would like to ask us while you have us here?
Okay.
You can take your time.
What do I have to ask you? There's, you know what, anything I have to ask you, I don't know that I'm going to be able to do it publicly.
Well, you can ask us. We can edit it out too if it gets too personal.
Let me think. Oh gosh. I don't know that I have anything to ask personally. I mean, I do, but it would be more, I would have to pay you for it. It's too deep. I mean, okay, so I do have I have a question for Sherry, for Dr. Ross. Okay, so you've been doing this for how many decades at this point?
Over 3.
Okay. So I always thought it's so interesting because we do have a mutual friend, one of whom was your patient, and then now her daughter is your patient, right? So like you are generational with right?
I am.
So what is is there any like what has changed in terms of how you communicate and what you offer? And also, my gosh, there's so many different, innovative things that have happened too over these decades.
It's a good question. I mean, and yes, I do now take care of patients that I've delivered.
Yeah.
That's wild.
And
That
it
is
is
so
strange. I haven't,
crazy.
and I delivered one of the patients that I delivered. So it was actually was a son.
Wait, I don't get that.
I don't get it
was
either.
I had a patient
Yeah.
and they had a son,
Yeah.
and then he married, and then I delivered their child. So it was the first baby, the third generation.
It's like a grand baby.
It's one of my grandchild,
Yes.
my patients.
Wow.
Yeah, it was cool actually. And so I think that there's the difference, I would say, because the younger generation tend to be my favorite generation because I really want them to like their healthcare provider.
Mm-hmm.
And sometimes I'll meet with them and we'll talk. I won't even examine them because I want them to, have a connection with me and sort of, their fear always is, oh my God, I'm going to have a pap smear, or they're going to do a breast exam or pelvic exam. So I find that I spend more time with the younger generation. And maybe I've done that all along, but I feel like this generation, they're more open to conversation and their sexuality and more curiosity about their health, their women's, female health. So I think maybe that's the only difference, is just much more of a connection.
Yeah. People are so much more like open about like even saying the word vagina now,
Right.
or vulva. Like people
Right.
didn't even talk about,
No.
anything.
They didn't, because the vagina was just everything down
Right.
there.
Down there.
Down there was
You
the
wouldn't
vagina.
even say vagina.
Right.
Like I was just like,
What did you
oh.
call it?
Me?
What
Well,
were you?
I don't-
Oprah called it her vajayjay, so there you have it.
I don't like I don't like cute names. You know what I
Code
mean? Like
name.
for me. I don't
What
did
did your parents
I
tell
have
you?
to be honest. It's too much. My father was an early adopter of like all of the sexual practices. So all of the things of like
Like tantra?
yes.
Oh.
So my father was like lifting weights with his penis, like his girlfriend was like holding the egg in her vagina. Like this is like in
Wow.
the 80s, you know what I
Wow,
mean?
very
so
advanced.
it's no surprise that I didn't want to talk about it.
Yeah. Right.
Just lifting weights with his
Yeah.
penis.
I mean, it's like that kind of ruins everything.
Right.
Like I had too much information. The beauty of now is everybody has too much information. And I think there's something, it's like the collective overshare.
Yeah.
But
True.
you know what I mean? So I think there's something that I love about that people are just out like that. But I don't know. I'm pretty like, I'm a little reserved on the one hand. And then on the other hand, I think it's great. Like I remember Our Bodies, Ourselves.
Of course. Yeah.
That was right,
was the
like
book.
the Bible or whatever.
Yeah.
And my first OBGYN was not you. Now I guess I've blown it and said that you have been, down there. But like she actually gave me a speculum, like a plastic speculum, so
To go
that I
home
could
with?
yes, so
Okay.
that I could check my cycle, because I didn't want to go on birth control.
Wow.
Oh.
Yeah. So it was before
The apps.
the apps.
Check your mucus.
Yes, I
Wow.
was checking. I was looking at
You
my
were?
Yes, I was
Huh.
looking at my os.
Your os. Wow, that's how you start. That's a good yoga
That's
position.
how I started.
That's a Cirque du Soleil position. Because
And
you need mirrors and everything.
Yeah.
But you
Yeah.
could also just use your finger and check your mucus.
Well, this is what happened to me. So I kind of
Wow.
like started there. You know what I mean?
Yeah.
Like
Wow.
I got clinical and like sort of,
Speculums and
Wow.
weightlifting and
the whole
all that
thing.
stuff.
Wow, but that's interesting.
it's all the
Fascinating.
spectrum.
Yeah,
Anyway,
it's
that's why.
fascinating.
Okay, there you go. So I don't know. All right, question for you.
Sure. You can ask me by email afterwards if you want.
Okay. Let's see. Well, I love what happened. What happens when you have a couple that comes in
Mm-hmm.
and
Are you asking for a friend?
no, because believe me, no family member, no. When somebody comes in and they're like obviously not open, I guess.
Not open to therapy or not in an open relationship?
Not
or-
open in therapy. Like not open
Mhm.
to
Conversation.
change
Oh,
or to
okay.
work on themselves.
Uh-huh.
Like where it's focused on one partner, for instance.
Mhm.
And that the other partner actually, maybe if they took a little bit of like how do you deal with that?
It sounds like a very
Specific?
personal, specific
Never mind then.
situation.
Okay, cut.
But I could answer it if you
Okay,
want
never
me
mind.
to.
Never
Do you not
mind.
want me to answer
No,
it?
I don't want you to answer.
I mean, it sounds like a time for free therapy if you want to take advantage of it, even if it's in the past.
Oh,
So,
really?
yeah, why not?
Oh God, it's too hard.
Well, let me just answer it in a vague way. So it's not,
Okay, how about this? For me, like I will ask you something
Okay.
personal.
scratch.
You scratch it. I'm so damaged from my parents' marriage.
Aw.
It's true.
Mhm.
That, I mean, I love my dad. He was amazing because he got into yoga and he kept evolving. But my parents were like 20 and 24 when they had me, right?
Aw. Mhm.
So my childhood is watching the deterioration of a relationship.
That's actually beautifully put. That should be in your book.
Okay. So thank you, because I think the next book is more of like a memoir about my childhood.
My childhood is watching the deterioration of a marriage. I mean, that's true for a lot of people.
Yeah.
But it's very beautifully said.
Well, it's the truth. And so I feel like because of that, I just have never allowed myself to trust
Mhm.
a relationship.
Mhm.
Even though I've had good love, I say I've had good love with like maybe the wrong people, even though they were great people.
Mhm.
Just maybe we weren't a match,
Mhm.
It was never going to work.
Mhm.
Is there hope for me?
Well, I would first challenge that it was never going to work and maybe they were the wrong people. And is it ever going to work for me? I think there's no mistake that we choose the people that we choose. Like partner selection, the reason that we pick the people we pick is for a lot of the reason that you're talking about. It's like we're trying to get the love that we didn't get. And so it'll only count if we pick someone who doesn't love us in the way that we didn't get when we were young. Because if they loved us in the way that we think we want, we're not going to love them back. It's like saying if my parents were never around and I felt like kind of neglected, I'm going to choose the person who's always going to be around. I'm going to make up for that neglectful childhood. But then they're going to be emotionally neglectful. And it's going to hurt in the same place because I know on this intuitive level that I need to work through that. And if I can get this person to love me, then I'll be healed from what I didn't get as a kid. We are like, we can pick them out in the building. There is no coincidence. I've been doing this for 35 years. I've never said, oh, I wonder why that person ended up with the person they're with. We try really hard to heal. To see in another person what we need to heal in ourselves. I don't think there's a mistake. I think you loved to the point that you felt you could. And for whatever reason, that was what, water rises to its own level. That was what you could give.
Right.
And that's what felt safe for you.
So just to be clear, you're saying that it's almost like you can't, in a way you can't go wrong. Like,
well, it doesn't mean you can't get hurt.
Right.
It doesn't mean, usually it hurts like hell.
So we have relationships to heal something that happened when we were young, and it requires going to the same places in a way. Is that what you're saying?
We're trying to grow up. You know, we're trying to heal our childhood wounds and like grow up with someone.
It's lifelong.
It's a lifelong journey. And so, you know, it's kind of why you fall in love with someone for this one reason, and then that same thing drives you crazy after like a year. You're like, I hate that thing in you for like the rest of your life. And, you know, it's those things that we're attracted to that actually we're trying to heal in ourselves. And so it's, you know, we always want to trade our partner in for somebody else. That's just natural. It's normal. There's nothing abnormal about your history. There's nothing wrong with you.
Yeah.
You're not broken.
Yeah. Thank you. I came up with a better question that might be more like, that might apply more to women my age, for instance. I'll talk about, since I went personal with you. You know what I mean?
You can ask whatever you want. Take advantage of us.
So let me ask a real question. Then if you choose to use it, you can. You know what I mean? Because if it's helpful to anybody else. So, okay. So I have chosen to like not do, so basically I'm let's see, menopause is like a year after you get after your last cycle, after your last menstrual cycle, right?
Yes.
So my last one was when I was 51. So then that's 52. So I'm 5 years out.
Yes.
Okay, what happens next? So I have not done estrogen or I haven't done any of the, I haven't done the bioidenticals. I haven't done any of it. I feel pretty good.
Okay. No symptoms. Or no symptoms that you're aware of. I mean, this is always the tricky question because you're not having like those vasomotor symptoms that we talked about, hot flashes, night sweats. You sleep well, right? But there's like 100 symptoms, right? So you're certainly not gaining weight or your weight's not shifting into the middle. But
it is.
Things like...
You look great.
But I'm 57. I mean, I have time.
Low libido or dryness, dry skin, vaginal dryness,
you wouldn't know.
Urgency, muscle pain. You know, there's like a host of symptoms that you may not even know that you're kind of missing out on. I mean, I think and I'll share this with you. So I'm 63. And I never needed hormone replacement therapy either. I never really, I felt some of the symptoms because I wanted to, but they weren't disruptive. Like they were noticeable, not disruptive.
I would put myself in that category.
Yeah,
like, you know, it's not the same as when I was 30. You know?
I mean, I think that the only thing I would definitely have you use is vaginal estrogen because for one thing, it's completely safe. It's absorbed into the vaginal tissue, and it really does, like, you don't want to wait for the problem of dryness. And I'm not even talking about sex. I'm talking about burning, itching, urinary frequency or urinary urgency, UTIs, loss of urine. I mean, those are the symptoms you will get from this genital urinary syndrome of menopause, GSM, very long word, but it will happen. And there's no, that you should use regardless because it's safe. And even our breast cancer patients are using it. And that would be the only recommendation. Aside from, weight bearing exercise, I don't need to tell you strength training and things for osteoporosis prevention. I mean, I'll tell you, there's been a lot of new data that's come out looking at people like us. And you're not symptomatic. You had some noticeable symptoms. What are the risks of not being on hormone replacement therapy?
Yeah, what are they?
So we know that there's maybe a higher incidence of heart disease, maybe a higher incidence, brain fog, brain issues, dementia. When women started hormones within the first 10 years of being on estrogen, they had it was almost up to 40 to 70% reduction of Alzheimer's.
Really?
Yeah.
Wow.
So it's kind of like those are some significant things. Of course, bone loss is important, bone, muscle, those are also important. But it's also probably would have been good for our lipid profile. Weight is we find that women who are on hormone replacement therapy tend to be more driven with exercise. They sleep better.
They have more energy.
So they're more energized. They have, less issues than those that don't. So the pendulum has swung a little bit over to people like us. Like, well, hey, maybe you should be on it. Even if you're not having disruptive symptoms, just noticeable symptoms. So, but I do think vaginal estrogen is a must. And it's easy. and there's no risk. Every 3 nights, there's a little vaginal pill you pop into the vagina. There's no mess. There's no issue. And it's a one-time user applicator, and it's very easy to use.
I have a friend who I have more than one friend that does this probably, but they do a patch. Is that
So that's
the same?
systemic.
Estrogen
That's in your
patch.
blood system. And
Uh-huh.
the patch is the first line of treatment for symptomatic or disruptive symptoms of menopause.
Mhm.
It bypasses the liver, so it doesn't go through the liver for breaking down. So there's no increased risk of blood clots or strokes.
Okay.
So it just depends on your symptoms, and everyone's different.
Mm-hmm.
Everyone's different. It's hard to compare to friends and stuff. Plus, you do yoga, so you are probably getting some of those benefits.
Well, I think it's a combination probably of exercise, but also I do I go to a naturopath and I take a lot of supplements because I did have a health crisis when, 11 years ago. And so that's when I started changing a lot of things.
Mhm.
I started changing a lot of things in terms of how I was supplementing myself.
Have you had a bone density?
Yeah, I
Okay.
actually do have osteoporosis in my lower back, but it's related to hyperparathyroidism.
Okay.
So that's the kind of thing where I do wish that I had started weight training earlier. Like if kids out there, or women in your 40s, it's time.
Yeah.
Because I do now, but yeah,
So you have low calcium.
well, I had hypercalcemia, but that was because so when you have, this is my understanding of it, the parathyroid is different than the thyroid, and you can get when you have this elevated calcium, it can indicate that you have benign tumors that are connected, and so these tumors, they leach the calcium out of the bones and into your blood. It gets into your bloodstream.
Yeah.
So one of the main ways that they can stop that is through surgery, through removing them, and then everything returns to normal. Or then there's also you can take some medication, like that. But anyway, I have been doing it in a natural way.
Yeah.
And so I'm just like, I watch and I keep an eye on things. Nothing is perfect. And so it's all just a matter of choices. And so far, I try to do things as non-invasive as possible. For a doctor, cutting into somebody's, throat is like, oh no, it's a really simple surgery. But it's like, well,
Still surgery.
Yeah. Like I've had that before with my knee. Like it's a knee surgery. It's the easiest surgery, a meniscectomy or whatever. And then you're like, he does the Lakers knees. Like, has he ever seen a knee as small as mine? It's like, this is a big deal. So anyway, that's Anyway, so it is interesting. Obviously, all of my friends are in this age group, many of them, and most of them are doing hormone
and
replacement
they
therapy.
should. And the other testosterones, I think I do like testosterone too, for muscle strength, and we're also finding again there's some benefits to heart health and brain health, and of course bone health with testosterone. So but at the minimum, vaginal estrogen. That's an easy one.
So speaking of your vagina,
yes,
we're going to ask
many
you.
have spoken of it. No, actually not that many.
It's famous. We're going to ask you the question that we ask all our guests at the end.
Okay.
You can choose to answer if you want. If your vagina could talk, what would it say?
Feed me.
That's perfect. That's beautiful.
I like the way you said it.
I know. It's great.
Well, that's from Little Shop of Horrors.
Sure.
For those, isn't that funny how somehow my vagina is like from Little Shop of Horrors?
It's hungry. It's very
the
hungry.
Venus flytrap.
Yeah.
Oh, yeah.
It's beautiful, actually.
Okay.
Is there anything else you want to make sure that you tell our listeners? Tell them how to find you.
Okay. Well, I'm Mandy Ingber on Instagram. I have a website, mandyingber.com.
It's INGBER.
INGBER, MANDY, INGBER. I'm offering astrology readings now to the public.
You
So
are?
so I'd love to read your chart. So you can book that through my website if you're interested in that earlier stuff that we just did. And that's it. see you around,
Yeah,
everybody.
thank you for being here so much.
And
Thank you.
you have yoga classes online and
I have my
your
I have my
program.
yoga philosophy workout
Mhm.
online. I've got my books that you can purchase. All the things.
Mhm.
What else? Is there anything else to promote?
And people should check you out.
Yeah.
Check it
Yeah.
out.
Check it out.
Check it out. It's a really fun way to get into yourself.
Yeah.
And
Yoga really is revolutionary when you first started. If you haven't
Mhm.
started yet,
Yeah.
just go and find your teacher.
Yeah,
Find the right
your
teacher.
way
That's
and
right.
and just do it.
Just do it.
And thank you for being here. And I know I'm going to see you at the next Rubble Bucket concert.
When is that?
I don't know. I know they're playing on the East Coast, but I don't know when they're coming. But I'll let you know.
Okay. Well, I love them.
Yeah.
Well, thanks, Mandy. And it's been a pleasure to get to know you. I really have enjoyed it.
Same.
I really,
yeah,
really
this has
liked
been
it.
so
Thank you
much
so
fun.
much.
So let's wrap up Mandy Ingber.
Yes. It was fun.
She was a delight.
Yeah. To really talk to someone who's been doing this for however many years. I mean, age 7 was when her dad really influenced her. But it's really fun to meet someone that's been really seen the changes too of yoga. Yeah.
You know, she makes it feel like anybody could do this.
Yeah. Yeah. She did. She made me feel like I could.
That's
Signing up.
important. That's important.
Yeah.
Yeah, and I like how she read my chart in like 5 seconds and told me
Nailed
something
it.
that was she did nail
Yeah,
it.
she did nail it.
Yeah.
That was pretty good.
I know. I might have to call her and get my astrology chart done too.
I was thinking of yoga, especially for back pain.
Oh.
And they talk a lot about yoga and back strengthening. So I'm going to definitely give that a try.
I know, and I slouch so badly, and so it's so good to do. There's such a somatic piece of like being connected to that and all the things that it means. Yeah, that was a good day.
Very good day.
Yeah, it was a good episode. Thanks, Dr. Sherry.
Yeah, thanks, Dr. Tammy.
Another episode of Paradox. Until next time, stay sexy,
Stay educated.
stay healthy.